So in the trachea, you have the cartilaginous ring. You have pseudostratified ciliated epithelia that lines the inside. Here's some adipose. Here's some glands that contribute to the mucus. And these little tiny cleared out areas in here, these little tiny light areas right there, those are goblet cells that contribute to mucus secretions as well. One cigarette inactivates the cilia. Just one cigarette. Okay? It doesn't bump them off, but it inactivates them. You smoke more cigarettes, you bump them off. But if you quit smoking, you can replenish them. Okay? So that's why you get smoker's cough, or smoker's hack. You're trying to cough up the mucus because you bumped off your cilia. That's the purpose of the cilia, is to pull the mucus up. So you can swallow it. Okay? Eventually. Yes?
Is there any other way you can paralyze your cilia, or like when you have bronchitis or something?
I'm sure there is. Certainly during an asthmatic attack, you could probably paralyze them. Yeah.
Does second unit snow cause that?
Yes. I can hear your head right now.
Oh yeah.
Yeah. Okay, so there's something wrong in this lung. This isn't supposed to be here. This is the boogers that are not being transported. The mucus. So this is probably a smoker. Here's some nice cilia in a healthy individual. You look at higher magnification, and there they are. They work together like a wheat field in the wind. It looks like waves. And they're connected by gap junctions. That's why they can do that. Okay, it's not haphazard. So here's some cartilage up here. Here's some hyaline cartilage that's stained with a specific dye. Okay, that's why it looks like that. Here's a nice healthy bronchiole and some nice healthy alveoli. Look at the architecture here. Nice and thin. So when you're in AMP1 and you're looking at simple squamous epithelia, sometimes they show you lung and you don't know what the heck you're looking at. Okay, you just know it's simple squamous and you're all confused until you get to this class. Or you're in my AMP1 class. Describe it for you. Okay, so these little droplets right here are just oil. Somebody put oil on this, and I forgot to clean it, so ignore that. So this is a terminal bronchiole. The terminal bronchiole still have ciliated epithelia in the lumen, so it's not a respiratory bronchiole. Here's a nice blood vessel. Here's some alveoli, and check these. Or here's some hyaline cartilage. Here's some alveoli out here, and this person has a problem. This is pathology. Okay, something's wrong here. This person probably has some sort of pneumonia because there's all kinds of stuff in the alveoli. And the alveoli don't have this nice, sharp, defined architecture like in this healthy lung. So this is a problem. Okay. Some more nice, healthy alveoli on both sides. Nice blood vessel. Okay, here is probably a capillary, and again some nice alveoli. Mucus-associated lymphatic tissue, a malt. Okay, if you see this in the lungs, it's responding to some kind of inflammation. So this person has some pathology too. And you can tell there's pathology going on because some of the alveolar walls are thickened. So this person has some sort of pneumonia. This one over here on this side looks a little better. Okay. Nice. I think this is healthy. Yeah, this is healthy lung. Here's a terminal bronchiole. And it kind of like got sliced on an angle. So it's turning into a respiratory bronchiole on this side. Okay, now here's the architecture that that's correct and erroneous here. Where is this? No, in there. Here. Okay, so let's make the comparison. You have a terminal bronchiole, and terminal bronchioles, they still have ciliated epithelia on their, in their lumen. And that's what this is right here. The thickening right here represents it. This is a terminal bronchiole. Then when it loses this stuff, this is still terminal bronchiole, this becomes a respiratory bronchiole. And then it leads into, here's the same respiratory bronchiole down here, then it leads into the ducts, alveolar ducts. Okay? So that's where this is incorrect then. This says this is a respiratory bronchiole and it's not. This is a terminal bronchiole and then this down here is the respiratory ducts. So again, A&P textbook's screwing it up. So let's get back to the histology so we can complete this for the sake of completion, nothing else, at this point. So here's some nice blood vessels, and this is a montage of the previous images. Terminal bronchioles all the way up to here, respiratory bronchioles, alveolar ducts going in here. And then the alveoli. Again, a continuation of the passageways. So you have to put these three PowerPoint overheads together. Okay? Starting with your mouth. Ending at the alveoli. That's the way the question is going to be asked. Okay, so high magnification of the ciliated pseudostratified columnar epithelia. There's some nice cilia there. This is a lower power. You see some, looks like veins. It's a lot of adipose, the hyaline cartilage, some smooth muscle, and the thyroid. And here's a parathyroid. Here's a large artery. Here's some skeletal muscle in your neck. Higher power of the smooth muscle of your esophagus. So here's your esophagus down here, and then your trachea up here. Higher power of the ciliated pseudostratified columnar epithelia. This is stained with a particular dye that makes the hyaline cartilage look like that. Here's a lower power of this image up here, down here. So here is the smooth muscle of the esophagus, and then the trachea. Here's some thyroid out here. I don't see any parathyroid. Here's more thyroid over here. Higher power of hyaline cartilage. Here's the perichondrium. This is where you can get a sample of perichondrium and grow the cartilage in culture if you wanted to. Okay? Because the cartilage in here is pretty much done. It's not going to divide it anymore. The cartilage out here can still divide. Of course, that's the perichondrium, not the cartilage itself. Here's some more adipose. Here's a blood vessel. There's probably a vein, judging by the way it's shaped. This is the epiglottis. The epiglottis has elastic cartilage in it. Okay? And this is the elastic fibers in the cartilage. It doesn't really look like cartilage to me, but it's labeled, it's categorized as being that. So there, you only have two places of elastic cartilage in your body, right? Your discs and your epiglottis. Okay, so you have three cell types that you need to concern yourself with. One of them is the alveolar macrophage. We've already done immunology, so we're not going to spend a lot of time here, other than some histology textbooks call them dust cells, because they mop up any particulate matter that makes it past your respiratory tree. We'll talk about it in a moment. So the other two cell types are type 1 alveolar cells. Those are the simple squamous epithelia that actually make up the alveoli. They make up the little tiny sacs. And then type 2 cells, they are the septal cells that make surfactant. Okay. So type 2 alveolar cells produce surfactant, a complex substance containing phospholipids and a number of lipoproteins. Surfactant reduces the surface tension in the alveoli and therefore throughout the lungs, thereby contributing to its compliance, in other words, its ability to blow it up. One of the major aspects of surfactant is dimethyl phosphotidylcholine. It's a phospholipid and a major constituent of pulmonary surfactant. So as I said when we were talking about reproduction before, that surfactant is the discovery that has allowed us to save premature infants at 22 weeks gestation. It's not the incubator, okay? It's primarily surfactant. Because children at that age, they don't produce surfactant. So you have to spray it into their lungs right when they're born. And that surfactant will get in the way of the hydrogen bonds between water molecules and water molecules in the container, which in this case would be the alveolus. So you inhibit protein, or you inhibit hydrogen bonding, which allows the lungs to inflate and allows them to stay inflated. Because without surfactant, they'll collapse, the alveoli will. And the alveoli are surrounded by capillaries. Okay. So the respiratory membrane includes the endothelial cell, the alveolar type 1 cell, and a shared basement membrane, and a little bit of mucus lining the inside, or a little bit of fluid lining the inside of the alveolus. So you can say you have 1, 2, 3, 4 cell membranes that the gas has to penetrate, and very little cytoplasm because these are flat cells. Okay? So gas has to go in both directions through this respiratory membrane. And then there's these pores of Kuhn. They're little tiny holes between alveolus that allow gas pressure to equilibrate across the alveolar walls. So when you're blowing up one alveolus, you're blowing up all of the adjacent alveolus as well, as a result of these pores in between the alveoli.